Welcome to today's update. I'm going to start off with a good news story from Australia. And then some of the goings on in the United States are a bit strange. And in the Netherlands, some things are difficult to explain as well, and a few other countries. We'll see how we go for time today. So all sorts of interesting things going on and things that are relevant. And I'm not going to analyse our Prime Minister's recent statement at the moment. We'll probably come on to that for UK news. But maybe not on this video. We focused on the UK yesterday quite a bit. So Western Australia, no community spread for 5 months. This is impressive. This report was provided by Rudi, who's lived in Perth for 50 years, and Mark McGowan is the Governor of Australia. And basically what he did was he closed off Western Australia. Bit like New Zealand really, but this is a land area. I mean, there's the sea on one side and land on the other. But basically, he closed it off, strict border controls, and they've had no community cases for 5 months. There has been a few clusters that they knew about that have been contained, and people have come back in who've tested positive, but it's all been contained in the 14-day quarantine period. So a major success story here in Western Australia. Even if it did annoy a few other people around about him, he'd done a good job. Catching a few positive cases every week from the quarantine, showing it's working. Never really had that strict a lockdown. It was fairly strict in the beginning, but not that strict in Western Australia. And now, because there's no community transmission, I think things are much easier. Still social distancing in shops, but mask wearing's not common. So basically, we did think that New Zealand was an exception because it was an island. But here we have a huge region in Australia where the same level of success has been attained due to the forceful use of the regional government's power to protect its people. So really a major success story. Now, just to start off with the United States here, let's have a quick view. Getting perilously close to the 200,000 deaths in the United States, unfortunately. Trend-wise, bit of a kick up in the United States there, as we can see in the data. But that's not the main thing I wanted to talk about in the United States today. What I wanted to talk about was the Centre for Disease Control. Now, on Friday, it put up some new information. So last Friday, up until yesterday, put up some new information. And on Friday, it wanted to make it clear that the virus is airborne. It once said that the virus is only spread by coughs and sneezes less than 6 feet apart. But it now wanted to make it clear infections can be spread through breathing infected particles that can travel further than 6 feet and linger in the air. In other words, the CDC has come up to date with what we've known about on this channel for 2 months. Probably longer, probably 3 months actually, and in fact we were suspicious of it way back in February. That this is an aerosolised infection. Our chief medical officer yesterday in the UK and the chief scientific officer used the term aerosolisation. This is an aerosolised infection, so it's good to see that the Centre for Disease Control came up to date last Friday, and various experts around the world applauded this. Hooray, the Centre for Disease Control is no longer 3 months out of date. But then on Monday it removed it from its website. Information posted in error. Now I don't expect you to take my word for this. So here we are. Now this is live. I've just clicked onto this live. A draft version of proposed changes to these recommendations was posted in error to the agency's official website. CDC is currently updating its recommendations, etc. And the advice we now have is what we've had on here for a long time. So person-to-person spread, all mention of aerosolization removed. This is what we've had here for ages. Now this is true, but it doesn't go far enough. People who are in close contact with one another within about 6 feet, we now know there's so many cases the virus has spread further than that indoors in stuffy environments. Through respiratory droplets produced when an infected person coughs, sneezes or talks. We know that, but we now know it's also aerosolized. And it goes on with the very out-of-date advice. What the heck has gone on here? So the Centre for Disease Control came into the 21st century on Friday then left again on Monday. This is very strange, very strange. Now, likewise, so posted in error, as you've just read. Now, likewise, the World Health Organization seems very reluctant to talk about aerosolization. So it talks about respiratory droplets bigger than 5 to 10 micrometers, which are proper droplets. It says smaller than 5 micrometers are aerosols or small droplets, droplet nuclei, and the difference is these are light enough to be suspended in the air for a period of time and can drift through the air, as we know. The World Health Organization saying respiratory droplet transmission within 1 meter. Well, this is simply not right. We've had so much evidence that the disease can spread more than this. And I've just taken this from the World Health Organization website this morning. Of 1 metre of an infected person who has respiratory symptoms. Now, it does admit that aerosol generating procedures in hospitals can cause spread. But it says this, to date, and I repeat, I took this from their website this morning, just before I made this video, when I was still preparing. To date, transmission of SARS coronavirus 2 by this type of aerosol route has not been demonstrated. WHO. So it seems like the World Health Organization and the information from the Centers for Disease Control in the United States now agree with each other. But let's look at counter-argument, as we've looked at in great detail, so I'm not going to do it again. I mean, this is we've basically proved this with evidence on this channel several times. And why are we still debating this? It's a bit like the Battle of Hastings. We know who won it. We don't argue about who owns Alaska. These things have been decided. It's a bit strange, really. But let's just give you a sparkling of the evidence, or a bit of the evidence. Oh, no, just before we do that. The evidence from clusters is pretty strong, and the World Health Organization says detailed investigation of these clusters suggests that droplets and fomite transmission could explain the human-to-human transmission within these clusters. In other words, they're saying that these clusters thought to be caused by aerosols could have been caused by traditional droplet and infected fomite spread. I'm bemused, but don't let me cloud you with my opinion. Let's look at the evidence. So, counter-argument, for example, British Medical Journal. We've done this before. We've done full videos on this. Since the 2003 SARS outbreak, research in aerobiology, physics and computational fluid dynamics has advanced our understanding of the aerosol generation and carriage on fate of respiratory particles. Right. So, and then that goes on to give great details of how this happens. This is nothing particularly new. It's explained there in great detail. There I am. Now, another one. This is from Clinical Infectious Diseases. Now, from memory, I think these were they were either both July or August. Is it time to address airborne transmission? 239 scientists signed an open letter, and this is in the Journal of Clinical and Infectious Diseases. 239 scientists signed an open letter appealing to the medical community and relevant national and international bodies. So national bodies would include the Centers for Disease Control, international bodies would include the World Health Organization, to recognise the potential for airborne spread of COVID-19. If it wasn't for airborne spread, why are we wearing masks? If it wasn't for airborne spread, why are we advising ventilation of buildings? You understand why I'm confused. So what we know for sure is that was updated at the Centre for Disease Control last Friday, removed last Monday, don't know why. Strange but true. Posted in error. Make of that what you will. I am not a conspiracy theorist, but this just does not... Let me put that another way. I perceive a huge gulf between the current advice from the Centers for Disease Control and the World Health Organization, and a huge body of scientific evidence, as we have explored it several times on this channel. I see a huge gulf between the Centers for Disease Control and the World Health Organization, and what Sir Patrick Vallance, the Chief Scientific Officer of the United Kingdom, said yesterday when he talked about aerosolization spread. We'll leave it there. India. Have I got some pictures of India? Let me think. Yeah, there we go. Just some of the data there from India. Cases round about the 92,000 per day. Reporting a bit of a down dip there, but let's hope that is accurate. And deaths in India well over 1,000 per day. And we expect the death rate in India to keep climbing, unfortunately. At least for a period of time, because of this lag effect that we are so familiar with now, and was again explained yesterday in the UK situation about the lag between the cases in mid-October and the deaths in mid-November. Now, India, the second only to the United States in cases. Deaths relatively small compared to that, but unfortunately more to come. Reports that the health system is overwhelmed in places. To be fair, the Indian health system can struggle at the best of times, especially in poorer areas. Chaos in places, shortage of medical staff and equipment, government hospitals at capacity. And because the government hospitals are at capacity in Delhi and Mumbai, that I know of for sure, probably in other places, the government has ordered private hospitals to take COVID-19 patients from testing facilities. The problem is, as I understand this from doctors on the ground in India, from a couple of different places, is the government's not paying for this. So reputable private hospitals in India are essentially going bust because they can't afford it. They're having to pay to look after all these patients, the reputable hospitals. The disreputable hospitals, of course, are corruptly charging people for their treatment. So what we seem to have is a selection process going on at the moment in India where reputable hospitals are being severely penalised and corrupt hospitals are thriving. That's my reading of the current situation. Who suffers, of course? Always who suffers? It's the poorer people that suffer. This is why it is difficult to discuss this rationally, because many poor people are suffering and dying unnecessarily. Right. So these are private hospitals ordered to take these patients. Right. So cases in Delhi, 200. Of course, the real number is way higher than that. 4,000 official new cases. That's for about the past 9 or 10 days, and now actually that's slightly out of date. No ICU beds in 8 of 11 top hospitals, even in private hospitals in Delhi, meaning people who don't get intensive care are much more likely to die. In fact, will be dying, of course. And many patients unable to find a place in hospital in the first place. So the kind of nightmare scenario that we're worried about for other countries is happening in India. Mumbai, not so bad. Busy but not intensive care basically at capacity in Mumbai, but other hospitals do have some capacity. The Indian government's reopening gyms, reopening most workplaces, reopened bars, cinemas are still closed, schools and colleges now reopening, and deaths likely to peak in the next few weeks. So not a good situation at the moment in India. Now, Netherlands, we've looked at Netherlands briefly before, but I want to cover it in a bit more detail today because there are some things that are a bit strange happening in the Netherlands. Keep disappearing, there we are. Right, so bear in mind the population of the Netherlands is only about 17.5 million, so smallish population. Now, this is straight from the government website. It's distancing to children. Up to 12, children do not have to stay 1 metre apart from each other or from adults. So they seem to be ignoring transmission in children. Now, what we know is children shed viruses with the same viral load as adults, and younger children with with a higher viral load than adults. But that's the regulation in Netherlands. Does it make sense to you? Doesn't really quite make sense to me. 17 and younger do not have to stay 1.5 metres apart from each other. Okay. It doesn't seem to have occurred to them that these children, young people under the age of 17, could go home and infect their parents and grandparents. Strange recommendations, to be sure, in Netherlands. Contact tracing, testing and staying at home. Again, this is direct from the website. Now, the good thing about the Netherlands is they publish in 2 languages. So they publish in full correct English as well as Dutch, of course. COVID-19 symptoms. If you have the symptoms, then got to stay at home for 24 hours. Well, we know that it should be at least 7 days. And 24 hours after you're symptom free. So again, that doesn't quite make sense. Children don't need to be tested unless they become seriously ill. Therefore, we cannot know what the prevalence of the virus is in children because they're not being tested. Okay. Okay, so there's some good things. They know about the ventilation and things like that. It's not all bad. Ventilation is stressed, which is good. Airing out rooms, which is good. So we agree with that. Now, face masks, gloves. So, right, face mask. So now this is straight from the Dutch government website. The literature does not offer a clear consensus on the effect of wearing non-medical face masks in public spaces. Wrong. We've looked at that numerous times. The literature that supports that is overwhelming. It seems likely that face masks help to prevent infections in others, but only to a limited extent. Well, no, it's to a big extent, and it also prevents infection in you, the wearer. If everyone follows the basic rules about distances, it is not necessary to wear face masks. Wrong again, it is necessary to wear face masks. And this is the government body issuing these in the Netherlands. It is not issuing a general recommendation to wear face masks in public spaces. Wrong. So 0 out of 5 there to the Dutch government for homework. Could try harder. Pity I didn't have a red pen to put the crosses in red ink. How do you make sense of this? I mean, the evidence for mask wearing is overwhelming. And yet, I don't know. Now, vaccine. Briefly before we finish. Oxford AstraZeneca vaccine. Trial still suspended in the US. So we've started up again in various places, but not in the US. Now, 2 British patients sequentially developed transverse myelitis. Now, this is a serious inflammation of the spinal cord. Now, the first one turned out to have multiple sclerosis. And this inflammation of the spinal cord can occur in multiple sclerosis. So the transverse myelitis that occurred was consistent with that patient having multiple sclerosis. So that was kind of overlooked. But then there was another case after that of another woman in the UK who also had transverse myelitis. If I can get my technology right, there we are. So there's a second case now recovered. So 2 cases of transverse myelitis, one of which could have been related to multiple sclerosis, one of which could have just been idiopathic, as we mentioned before. But that's 2 cases out of 8,000 doses of vaccine given. If there's another case or 2, certainly if there's 2, then I think that means the Oxford vaccine could well be have a limited future in its current form. Anyway, I'm glad to see this woman's recovering, which is good. So trials going on in Britain, trial continuing in Britain, Brazil, India, South America, but not going on in the United States. Now, it needs to demonstrate, to demonstrate a 50% efficiency, you need 150 confirmed cases amongst trial participants to have been prevented. Now, that doesn't sound like many, but it's actually quite a lot, because they have to show that the vaccine has prevented 150 infections in the wild situation. So you kind of got to wait for people to become infected or not. If it's proved to be 75% effective, then that could allow for an early license. But there was no question there is a question mark as a result of these two cases of transverse myelitis. The multiple sclerosis one, yeah, it could just be the multiple sclerosis, but anyway, I'm glad to see these patients are recovering, so that's good. Basically, we need more trial data. This is why we do clinical trials, of course, to find out the safety and efficacy. So, waiting to see on that one. Now, when we do get a vaccine, how is it going to be distributed? 172 countries, according to the United Nations, have signed up for this COVAX initiative. I think the World Health Organization is using the term country quite liberally there. The actual number is probably 156 countries to distribute these vaccines globally. Because this is a global problem, we need to distribute the vaccines globally, of course. It's obvious, isn't it? Because people from other countries could, if people in poorer countries are carrying on spreading the disease, it could become endemic, and then it could come back to richer countries. So it's obvious, patently obvious, that this needs to be done globally. You don't need to be a clever clogs to realise that. It's pretty obvious this needs to be a global approach. And yet, the governments of China and the governments of the United States have not agreed to take part in this programme. As of yet. Let's hope it's just a bit of a delay. So, interesting things going on. We can't always explain it. It just shows to me we've got to be led by the science, by the evidence. And we've seen examples of people that don't seem to be going by the evidence at the moment. But I feel I've provided the references in this video. Of course, I always post all the references in the description. You can check any of them you like. All the videos I've done, I always post the evidence, and I hope I'm being evidence-based and objective. That's why it surprises me that national and indeed international agencies don't always seem to be as evidence-based as we're trying to be. Okay, thank you for watching this video as always.